Well, for more on the novel coronavirus, let's speak now to Professor Tikki Pangestu. Professor Pangestu is a visiting professor at the Kuan School of Public Policy, and he joins me now in studio. So there's a lot of noise around this virus. On the one hand, we're being told, don't panic, just wash your hands. On the other, we're seeing analysts and researchers saying, look, this virus is actually more contagious than we think. It's actually starting to mutate. How do we balance protecting ourselves versus overreacting?
I think the most important thing in all of this is public communication, to sort of base whatever you do on the data and on the evidence. As far as I'm aware, there is no real evidence yet that the virus has mutated, so to speak, and that it has become much more able to spread. So until such time as that is confirmed, I would think that the current situation is not a real cause for panic. That's the way I see it.
So every day, though, we are seeing numbers cropping up, not only in China, but countries around the world now.
Sure.
Clearly, more people are being infected,
Sure.
more are dying from this virus. Is that a cause for concern?
I would definitely say that the situation in China is still very, very alarming. But if you look at just in the last few days, no new countries have been affected just in the last 24 hours. In overall terms, the fatality rate is still very low. And also in the sense that wherever there has been local transmission, okay, those people who have been affected have really had a travel history to Wuhan. And those in Singapore are actually well taken care of. I mean, they're well. One of them has actually been discharged. So I think based on those sort of situations, for me, there's no real cause to panic.
So many of the patients were infected after visiting Wuhan. But some now, including in Singapore, it is a limited community spread in that
Sure.
they've dealt with people who were in Wuhan.
Right.
Is that troubling?
If you assume that those people were infected and they were in close contact with, let's say, in the local population, and you do require close contact, and this is spread through droplets, but importantly also from touching surfaces which have been infected. So you need to be quite robust about how you investigate what kind of contact they have, and then decide on that in terms of the potential of that spreading. But at the moment, I think the risk for community spread in Singapore is still fairly limited, and the government is having that well under control.
Let's get technical. Let's get
Sure.
scientific here. What is the R0 of the disease? Break it down for us, and why is it important?
Yeah, just very quickly, R0 is a measure that sort of indicates how many other people an infected person can spread the virus to. So if an R0 is 2, it means that one infected person can spread the virus to 2 other individuals. So if the R0 is greater than 1, it means that the virus will continue spreading. If the R0 is less than 1, the outbreak will die out. Now, having said that, the R0 for the Wuhan coronavirus is around 2, okay? It's about the same as what it was with SARS. Now, you compare that with measles, okay, childhood disease, that has an R0 of between 16 to 18. So, measles is much more contagious, and so is seasonal influenza. Having said that, there's a lot of misunderstanding about this R0. What I want to emphasize is that it's an average number, okay? It's very difficult to measure, especially in the situation where it's changing every day, okay? So you could have one person infecting 100 people, they're called super spreaders, and you can have 10 others who infect nobody. So take it with a pinch of salt. It's an average, it's difficult to measure, especially when it's changing so quickly.
During the commercial break, we were talking about borders and closing borders, limiting the movement of people to prevent the spread of the virus. No border is impenetrable.
Right.
So do you think the limited flights we're seeing, the closing of certain entry points, is this more for optics, or will this actually prove to be an effective way to contain this?
If it's done early in the outbreak, yes. And I think in the present situation, it will help to slow down a little bit. But in overall terms, as you know, WHO came out very strongly. We do not recommend bans or quarantine. And historically, it's well proven that it doesn't work. Why? Number one, by the time you put in a quarantine, usually it's too late. Wuhan is well known. Before they put in, 5 million people have already left the city. Okay, and as you know, many of those people don't show any symptoms. And there are many, many historical situations going back centuries where it's shown not to work. And on top of that, there's so many downsides. Number one, there's the cost, the logistic. NUS at the moment, having to take care of all those students, distributing, giving them food when they're not allowed to leave their hostels for 14 days. That's one. The social and economic impacts, that's going to be huge, affecting civil liberties. And many people will tell you that quarantine is actually going to make the situation worse. When it's quarantine, people go into hiding. They try to escape, okay? These people have a limited access to medical services. When you have a ban on travel, medical supplies can't go in. Importantly, the healthcare delivery system is looking after all these people instead of looking after other health problems. So the other big issue that's come up is in relation to misinformation and hoax news. This ban has resulted in a lot of xenophobia against, for example, in this case, the Chinese. Okay, so that to me is, there are many, many reasons not to impose a quarantine. Now, having said that, I think if it's done in a sort of a stage-like manner, okay, and if it's done early, yes, it can help. Most importantly is, yes, you can start with a set of measures, but when the evidence tells you that the situation is under control, slowly pull back, throttle back, and in the whole situation, engagement and cooperation with the public, that is the most important thing. But evidence, public cooperation, those are the main things.
And before we let you go, listen to the statement. We are on the verge of becoming part of a worldwide pandemic. Would you agree with that?
No. Okay, this is my own personal view. Looking at the scientific data and the scientific evidence, it really depends what you mean by pandemic, because there are many different definitions. But if it's pandemic, means very widespread distribution with high fatality rates, with no vaccines, etc., etc. I don't think this is going to happen here, because as you know, even outside of China, the number of cases is just 150, 160, and they're all not severely ill. As we talked about, the transmissibility of the virus seems fairly low. So I'm optimistic. If I had to make a prediction based on other outbreaks in the past, we are probably close to the peak, and I'm going to sort of stick my neck out and say by April, things are going to quieten down. I may be proved wrong.